Chris Johns from the Building Communities Trust. We support asset-based community development across Wales, and we facilitate a network of over 120 local community organisations.
I'm Noreen from the Coproduction Network for Wales. We're a non-for-profit organisation, and we support a community of practice across Wales and across sectors of people who are committed to co-production and citizen involvement and related person-centred, asset-based, relationship-focused approaches.
Hello, I'm Ruth Marks. I'm the Chief Exec of WCVA, Wales Council for Voluntary Action. We're the national membership body for the voluntary sector in Wales, and pleased to work in partnership with the organisations that Noreen and Chris are involved with. We've got several questions that we've been mulling over and are interested in chatting through as a group this morning. And the first one was as regards changes that we've seen since the COVID pandemic. And I've got a few points that I'd be interested to see what Noreen and Chris think. From the voluntary sector's perspective, I reckon that the sector pivoted absolutely immediately. That the world became aware and the world in Wales became aware of the pandemic. But in actual fact, the sector had pivoted almost prior to lockdown as well, especially the sector that's active in the South Wales valleys, because there was the experience, of course, of the floods as a result of Storm Dennis in February time of 2020, and that almost led us straight into the lockdown arrangements. So sector response was immediate in response to the pandemic, if not before. And the sector, by pivoting, I mean, turned all attentions and all discussions as regards what can we do, how can we help? And so that linked into the amazing community response that came from all over Wales, and an increased interest in volunteering, both in an informal sense, in a neighbourhood sense, and also in a formal sense, which created both opportunities and challenges that would be good to chat about later on. There was a huge increase in relation to online communication and also online engagement, and that gave certainly members of WCVA and WCVA ourselves as an organisation a great chance for increased connection with people and with organisations all over Wales, but it also really, really highlighted increased inequalities in relation for people to be able to engage, and also wider inequalities in Wales. And I think those are the main changes that I've summarised from the range of experiences that myself and colleagues and members have been speaking about over recent months. How's it been working from your perspective, do you think, Noreen? What sort of changes have you seen? Yeah.
I completely agree with what you've just outlined. That really resonates with what we've been seeing. We tend to work a bit more with organisations, statutory, and people who deliver and produce public services. And there's been a real recognition, seeing the community response, very local, very adaptive and fleet of foot responses that we've been seeing in communities. Actually, councils and statutory organisations have been recognising that there's a power, and they're able to be nimble in the way that larger statutory organisations can't be. And it's been lovely to see that growth of trust and acknowledgement that there's real value there, which I think has been probably quite undervalued, it's fair to say, until now. And that sense that, communities are awesome at doing some stuff that we can't do as professionals, but there's some stuff that we can offer as professionals that can support what the communities are doing. And there's been a shift in that direction, I think. Chris, does that make sense with your view of things?
Absolutely. I think one of the challenges that was faced by many community organisations, and I think in playing the roles you talked about, was suddenly seeing a lot of the people who were stalwarts of community action actually feeling they had to step back in many areas because of health concerns. Many of them were older members of the community. And a lot of the newer volunteers that Ruth was talking about actually took the place of those people because they were younger and felt more confident about their health. And in many places, this happened not quite seamlessly, but the gap between it happening was pretty small. And we saw this ability then to carry on with the community response very swiftly take place. So in some cases we've got new groups forming, but in many cases we're actually using the resources and contacts and facilities of existing community organisations. One of the glitches we had to get over, which was a quick one to get, and really bore testament to the collaboration across sectors, was a question of what was allowed and what was not. Could you open your community centre to provide a food bank? Could you keep your kitchens open to provide immediate emergency meals? And there were difficult questions being asked even by the police about that in the first couple of weeks. And actually, because we had the right chains of communication going on between different bits of the public and third sectors, those questions were answered pretty quickly, and then people could get on with providing the emergency support. The other thing I would say about the emergency support is the nature of it evolved over time. We started with medicine and then food, and then actually we saw a shift into worrying about well-being and mental health and the impacts of isolation, both on older people who weren't seeing anyone at all and younger people who were kind of cooped up in their houses and getting desperately frustrated. So there was a broadening of the range of types of emergency support provided, and an increasing amount of imagination about how they were addressed as well, I think. The other change we saw, which was hugely helpful, was on the behalf of funders. We saw I think it's fair to say the trusts and foundations shifted first, because they're, in a sense, they can shift faster than institutional funders can because of the way they're governed. And we had funding schemes on tap even by the end of March, which people were able to address. Welsh Government and the lottery came in a little bit slower, but not much. And again, significant amounts of very flexible funding was available. And I have to say, I don't know of any project that's lacked for money. I think the support has been so comprehensive in that regard.
Yeah, absolutely. But I think one of the first comments that you made, Chris, was as regards challenges for people who have been really sort of, the cornerstones of their community and active in particular groups or communities of interest for many, many years, and then possibly restricted from the type of involvement they've done, and other people getting involved, which is great. But there's probably a range of other challenges as well that you've come across, Noreen, that are interested to chat through as well. Certainly from just listening to the two of you just now, there's a couple of others that have come to my mind. So it'd be interesting to see what Noreen reckons in terms of challenges. And also it's probably some things that we've learned as well, do you think?
Yeah, definitely. And often they go hand in hand, actually, don't they? I think apart from the obvious challenges of, time and urgency, which is that was imposed on everybody, and the need was high and it was very immediate. I think the challenges that contribute, that feed into that, skills and confidence for me are the things that stand out the most in lots of different areas. So, people being confident and having the agency and believing that they're allowed and that they can just absolutely go and do things and take action. Having statutory organizations going, oh, all these communities are doing all this stuff. Is that okay? There's no, where's the regulation? Where's the, it needs to be processes, and actually no, it just needs to be a response. And so that learning of going, oh, it's okay to let them get on with it and to let go, because they know what's needed, it's their community. And then of course there's that increasing recognition of the role of who can offer what, and that trust growing. That's part of that learning from the interaction. And the biggest learning, I think, for a lot of people has been the shift to digital as well. So I've just jumbled in a lot of different aspects into one bag, but I think there's been an upskilling at speed, which has led to growing confidence at speed, I think, which we could do a bit more of. There's a way yet to go on this journey, but it's really taken a big step towards we can do things differently and we can use different tools and platforms and skills, and it works.
One of the interesting conversations that I had with colleagues who are working locally and regionally, and then also conversations with other colleagues who were working nationally, was that often the things that Chris is talking about as regards immediate responses were organised locally, if you like, under the radar, national people who possibly thought it was their responsibility to be in control or be in charge didn't even know about it. And I was sometimes in a national conversation and being asked, oh, can you help us out with X, Y, Z? And I was like, okay, fine, let me go and chat to some colleagues. And the colleagues would say, you're 2 or 3 weeks behind the curve, Ruth. And actually, this is already happening. Let us show you what's been happening. Is that of any use anywhere else? And we got this phrase together that what was really helpful was a national support blanket, if that was helpful. But what nobody wanted, and nobody intended it to happen either, but nobody wanted a national smothering blanket. So it's that thing of collaborating effectively and nobody presuming anything, asking and involving people. And I think that's one of the challenges as regards getting people to sort of change behaviours and sharing power, really, which is around an awful lot of what we're talking about, is really, really important. Were there other challenges that people that you work with talked about, Chris? I think
there are probably 3 kinds of challenges that come to mind, which actually echo very closely Noreen's. One is communication. And looking at it from a local community perspective, one of the most obvious problems was that people were used to doing face-to-face meetings and decision-making, which had all gone by the by. So you suddenly have this gap about how do you almost come together and make local decisions about what you're going to do. I mean, people resolved that, obviously, but it was a challenge to start with. And there's also the communication outwards, to things happening, to local authorities, to CVCs and so on. And some community organisations are really well networked in that respect and others were not. So that was a bit of a challenge, a very differential challenge in different areas. And some local authorities and CVCs made really good arrangements to have a kind of streamlined communication from, if you like, county level down to community level, which was very widely shared and understood. In other areas, that was much more haphazard, really depending on who you knew. And it's quite interesting talking to colleagues in different parts of the country how differently that worked. And it meant the flow of information was a bit erratic. Yeah. There's also that really, you've both alluded to risk-taking already. And I think one of the interesting things, and I think this was all kind of the conversation in Welsh Government as well, was a degree to which community organisations were happy to take risks that the public sector wouldn't take. And I mean it in very practical ways, in things of going to do door-to-door food drops, people who couldn't come out of the house and hadn't got any money, and also in actually giving cash payments to people who were really struggling financially. Yeah. And the degree to which some of the bigger, more structured bodies would say, "Oh God, you can't do that; it's too scary," and some would say, "Oh, fortunately, they can take that risk, and we can't." Yes. And there was a big difference there. And I think and I remember discussing that with Welsh Government afterwards. And to start with, they were saying, "Oh, this is a terrible thing; they're taking these risks," and then realising that it actually could be an asset. There are people willing to take some of these risks that organisations with employment and liability are very, very nervous about. The other issue, which I think we have to be really careful about what we learn about, is about IT and the use of digital communication. Because I think we have shifted to doing lots more online. One of the big advantages about that has been the ability to communicate with people in all parts of the country and pick up learning at vast speed. And obviously, for people who've got the kit and the skills, the ability to reduce their isolation even when they can't move. But I do think we need to recognise that if we assume there is a mass shift to digital, we will leave significant numbers of people behind. And we also can't afford to assume that's just about skills and confidence. There are a significant amount of people who simply can't afford the kit. And that is a barrier that remains under-recognised.
Yeah, go on.
There's something about shifting to digital, but actually it's not digital that we're shifting to, it's remote. And remote doesn't necessarily mean online. Remote might mean a letter drop or a phone ring round or waving through the windows. that is also important, and we need to look at all the channels, and digital is only one of them. And as well as the digital challenges, we need the tech, we need the data, we need the data to come to us. Is there fast broadband where we are? Do we have the actual equipment? Do we have the money? But also, do we have the home conditions to do it? Do we want to do a video call when there's a lot going on behind us? How does it fit into people's lives, and is it what they want? And it might not be, and I'm worried that we're not asking enough. What do people want? And it's a fine balance that if people don't know what's available or what's possible, they might not know they want it. But we also need to check that does really fit in people's lives.
Do you think one of the other challenges, and it's partly linked to digital and communications in a way, as regards where people get their news from, do you think one of the other challenges was that all of us might have been receiving some information through social media channels, some of it through chatting to people in whatever way you could chat to people, and some of it through the media, radio, television, that often presented information from a London or an England perspective. I think one of the things that's been great is that there's been a bigger understanding as regards what's different across the UK, and what power exists differently across the UK, and what information, what decisions are made in different parts of the UK. But certainly from some of the bigger national charities and some of the links that they might have had, say, with the Department of Health in England, some of the very early volunteering apps, for example, encouraging people to sign up, caused some challenge as regards some of the infrastructure that exists currently in Wales, but has also then given us something to learn from and reflect on and to improve on in the future. I don't know if either of you've got any reflections as regards where we get our news from at all, and whether that created any challenges.
I think two reflections. I think first of all, and this, given all the kind of COVID denial we've got kicking around bits of the social media now, one of the great reliefs actually is that in practical terms, this doesn't seem to have had any major footprint in terms of the work we're doing. We haven't seen people picking up nonsense from social media and trying to use that as a guiding point for their decision making. So it does mean that the official information channels were by far the most trusted ones. I think there was an element of saying, to start with, look out for the Welsh guidance, if you like. But I do think people got into the habit very quickly, including people who work at community level, who aren't necessarily tied into Welsh government type of decision making, of thinking, actually, does this apply to Wales? Because I think that became part of the mantra, if you like. So people were looking out for it. And I think also bodies like CDCs got quite good quite quickly at sharing information on things like regulations and getting it down to community groups quite quickly. I mean, obviously often alongside local authorities. So I think for certainly people who were in the system, in terms of, it's known you're providing a food bank, or it's known that you're doing medicine drops, you would get that information. And it was pretty well attuned to local circumstances and regulations.
So in terms of some of the collaboration that we've been talking about, and some of the sort of rolling back of bureaucracy, and I love Noreen's phrase about sort of being fleet of foot and people sort of getting on with things. In terms of stuff that's been learned and stuff, if you had a magic wand, Chris, and you reflected on the things that have been learned and the things that you'd love to keep, what would be the range of things that you'd want to bundle up and keep as we go forwards, and keeping the best of what we've learned and dealing better with some of the challenges that we've experienced?
Flow of communication and information both ways. I mean, I think there's been, as Noreen alluded to, a lack of mutual understanding about what goes on in, if you like, local, social, regional public bodies and community level organisations. What are people capable of? And I think that goes both ways, actually. I think there's a lack of understanding and a lack of relationships, actually. Not necessarily bad relationships, they just don't exist. So that is definitely one. I think the way funders work, and I've seen there are steps actually amongst non-state funders to try and entrench some of the learning of that that are now coming through the Wales Funders Forum. And I think the need for, very flexible, less earmarked funding as a way of entrenching community-based work is a critical one. And then I think also recognizing the different types of support that people really benefit from are ones driven by their circumstances locally, what they can access, what they want to do, rather than necessarily making it entirely needs-based and therefore excluding people as a starting point because you're not needy enough. Because I think one of the things we've gained from this is the ability to draw on a wide range of talents within communities. And if you're going to do that, you need to make sure that the ability to take part is as broad-based as possible.
Yeah, that's an interesting point, isn't it, as regards to the increased inequalities that we've been noticing as well. There's probably a range of things that you'd love to keep as regards to sort of some of the positive experiences or some of the learning. If you were summarising that, Noreen, what do you reckon you'd cover off?
I think I'd very much echo what Chris said in terms of the recognition of the value, that reciprocal actually between communities and the state, reciprocal recognition of the value that each side can bring to an interaction. And yes, there's been lack of understanding, there's lack of relationships, but actually these relationships have been created during this lockdown, during the pandemic response, and it would be a waste to kind of go back to how it was before. We need to keep building on these relationships. And the larger organizations must be so careful not to try and appropriate what's happening in communities and thereby crush it, because it gets fed into a machine full of systems and cogs and layers, and actually we would lose what's good about what's happening in communities. So letting people do what they're best at while we can support with the bits we're best at, rather than trying to take over. And the other thing is about the inequality and this opportunity. I mean, it's increased awareness about all the different kinds of inequalities that people have been suffering forever, but have really, been brought into the light during this response. And actually, can we keep working on that? And it's by no means perfect, but, let's not forget all the stuff we just learned and keep including people, going to the seldom heard voices, worrying about representation and diversity, and making sure people are around the table to have these conversations as opposed to being on the menu.
Yeah, we've spoken a lot about community response and links with local authorities and small local groups and maybe national charities and Welsh Government and so on. Any experiences that that you or your colleagues have been involved with in relation to businesses, either local businesses in communities or any of the bigger private sector employers? I know we haven't got many of them in Wales, but we do have some. Any reflections as regards that sort of collaboration space with the private sector?
Yes, quite a lot actually, particularly on the question of food support. What was really scary in the very first week of lockdown was this drying up of the normal source of fair share food supplies, which are largely supermarket near expire food. And then after about a week, the companies had made a decision that they were not going to dry up that food supply, however much normal demand was. So you had the supply suddenly reopen again, and they made a real effort in making sure that people providing food support had a very easy access to food. And we could see that in a number of the projects we were supporting. And suddenly, actually, people needed money for transport so they could go and do the pickups from far and wide. So definitely there. And also, there was a lot of support from smaller food providers, both grocers and restaurants, in providing food as well. And in many cases, building quite entrenched relationships with community organisations. So they were really alongside them. Probably a little bit easier in that sense for independent businesses because the management control is local as well. But certainly the big supermarkets kind of had clear policies which were very supportive of certain types of community action.
Yeah, so that would be really good, presumably, to sort of try and keep hold of as well and capture. So all the links and connections that have been made across all sorts of different organisations in across all sectors, holding on to that and building those relationships that might help build, it's phrases, isn't it? But building back better and building more resilience into communities and involving more people and stuff. If people have tried that and it's worked and they've enjoyed it, they've put something in, they've maybe got something out, but they realise it's all to the good, then those are presumably the things that we really want to sort of to harness and to keep shining a light on as we go forwards. Do you reckon people are tired now, though? Do you reckon people are a bit tired, a bit fed up?
Definitely.
Yeah, absolutely.
Yeah.
It's just, there's nothing we can do about it, but it's going on. It's been a lot of pressure, and it's been that the mental strain of constantly adapting to change. We haven't, it hasn't changed from one thing to another. It's a constantly evolving situation, and that's tiring. And I do worry about, the knock-on effect on mental health for everybody involved, people who are isolated, staff who, bearing an increased workload, everyone, and we'll be dealing with this for, the next decade probably, but it is what it is. And you mentioned something, Ruth, just now about, the change in the relationships and the new relationships and that have been forged that underpinning how people are adapting. And I think that's absolutely key in everywhere. All the positive changes we've seen and all, everybody pivoting or growing trust, and it's all about building these relationships, and they're so precious. And I think they're going to be, for me, they're the key to pretty much everything. How do we support each other? We're all tired, we're all exhausted, there's for lots of different reasons, but how do we stick together and support one another to keep this thing going?
Chris will have some thoughts on that, I think, just before we finish, probably.
Yes, I echo everything Noreen said. I think one of the things that worry me actually is that figures that within public sector bodies who weren't at the heart of all of this won't value it, and when to a certain extent will just revert to normal. And I've heard that expressed by colleagues in local government in particular. People who've really seen the benefits of this are worried that it won't be entrenched within their organisations.
Right, that's interesting, because one of the phrases that I heard last autumn that the Public Services Minister used in a meeting between the Welsh Local Government Association and Welsh Government and a couple of other observers was the phrase about hardwiring, the community response and taking the best learning and working together, collaborating to try and not revert to normal. So I suppose it's incumbent on all of us to use whatever conversation opportunities we've got or influence that we've got, and all, of course, all the material, all the case studies, all the examples from projects and organisations and individuals that we've spoken to over the last year to feed that in to keep going. So my final line on this in this conversation is that the sharing power, that principle of sharing power and seeking forgiveness if needed, as opposed to asking permission, and sort of risk taking, like Chris referred to earlier, and collaborating that absolutely every individual and every organisation has got something to give into this. And if we strip off all titles, strip away all ego, and strip away all sort of competition angles, and just say, how can we work together to giving of our best, which then collaborates in a kind and effective way, and plays to everybody's strengths. Is just, common sense, isn't it? Bring back common sense.
And kindness. You mentioned kind and effective way, and yes, let's put kindness at the heart. That will help us make good decisions.
Exactly.
I do think that the hard wiring you refer to does need a quite conscious plan of work to make it happen. I think the good news is there are various building blocks starting to come together to make it happen, but I don't think it will happen by casual goodwill.
Agreed.
Absolutely. But would you also agree, though, that some people like to be involved in the conscious planning and some people don't, but at least everybody's voices should be sought and those experiences, because there will be still some experiences going on that we're not aware of, and that constantly asking and constantly involving people is the only way that conscious plan will be the best that it possibly can, and that it's not fixed in stone, that it's
absolutely, yeah.
Brilliant. I've really enjoyed this conversation. Thank you ever so much.
Me too. So nice to catch up with you both.
It's really good to see you.